the big question, right? Everybody's concerned. A lot of the people I talk to in person, but when you read online, does TMS cause seizures?
Yeah. TMS does not cause seizures, right? There is a very, very, very low risk of a seizure, right? Or I should say it doesn't cause epilepsy, which what people I think confuse.
There you go.
There can be a risk of seizure, which is very low, right? The risk of seizure is lower than for medications. Um,
Mm.
it's lower than, Game Boy. If you look at a Game Boy insert, it's like one in I think 4,000, right? Because of like some of the lights, they warn you that.
Yeah.
There's
They
and
have the warning
blackouts.
on there these
Yeah, there's
days.
a warning. That's worse than TMS. So, yes, there's a very, very low risk. And I think early on there were more, there were a few more seizures. And when you looked into it, it had more often to do with two factors: wrong placement of the coil, right?
Yes.
Devices weren't so great in the beginning at assisting, right, proper placement. You had
Okay.
to manually move. Now a lot of the devices, it's sort of built in that like that happens.
Uh-huh.
And there's like things where it won't start. It's there's better backup systems, and so sometimes people would find the motor threshold and then not move the device where it should be treated. And if they're treating over the motor threshold, there'd be a seizure. And then I think the other time that we do see it often is there really is a biological reason. So the person maybe abruptly stopped more heavy alcohol use than they had been honest about.
Yeah.
And
Yeah.
right, just
Guilty.
yeah. Um, or when there is one, like there's a group of people that we're very cautious with, and we're very clear that we'd rather them not come in if it happens. But when we treat like overnight medical staff, people that can do shifts and
Oh,
stay up, yeah. So they stay up all night, they have coffee all night,
all
they're
night.
gonna
Yeah.
nap. Two things we know lower seizure risk, and then they wanna come right to TMS. And I'm like, "Uh-uh. You gotta
Yeah.
go to bed and you gotta come before your shift," right? Or especially if you do it, sometimes you get stuck. You know what it's like. You get stuck in the ER, and
Uh-huh.
you're doing an extra shift and then you come for your TMS. So those people, I'm very careful to say, listen, like obviously no charge. Like we don't want you to come if you haven't slept and you've drinking a lot of caffeine.
Yeah.
But risk of seizure alone with properly, done right, is incredibly low. And like I said before, I mean, this isn't a great thing to say maybe to patients, but worst thing, you're in a really safe place when you have a seizure, right? It's having a seizure, right, is like the risk of that is you're driving a car, you fall down and hit your head, right?
I think you're so comfortable with it because the amount of people that you've treated and you haven't had one there. But
Yeah.
when you talk about it, you're so comfortable with it. It's insane. You're like, yeah, no, you're in a safe place. And I'm assuming that it's because it's never happened, right?
Well, you're right. I might say differently, like, don't jinx me.
I don't want to, but I'm like, when you talk about it, I'm amazed, right? You're like, no big deal.
Well,
But
and I do think
I
that's
understand.
that's also a misconception of like, when do we want people to have seizure? No, but it's not good for their brain. However, like we need to remember what ECT is, right?
Yeah, there you go.
ECT is an induced seizure,
Uh-huh.
right? So so I think people forget. Yeah, I think I am more relaxed because what we care about the most with seizure is you do not want to be driving a car or hit
Yeah.
your head. Like a seizure itself is not really that bad. You're in a safe place, you're supported, right? It's okay. Then we got to figure out what happened, right?
Right.
But I can think of a lot worse, I guess. Like I said, my biggest fear is somebody has a heart attack or a stroke, like in my sight, right? Not like a seizure on handle.
Yeah, I got this. Hey guys, I know you like that video. Do yourself a favor. Click on this one right here. More content about TMS, the benefits of TMS, and how we're going to change the world with TMS. Did you click on it? Click on that one right there.